Most founders sound exactly like the competition. If you want to be competitive in a crowded market, you can't just be better, you have to be different. I'm your host, Cameron Olds.
And I'm Dallin Merrill, and we're here to talk about how you can avoid being mistaken for your competition, differentiate your brand, and ultimately create a lasting competitive advantage for yourself in the market.
Welcome to Differentiate or Die. This episode of Differentiate or Die is brought to you by MessageOS. And by brought to you by, we mean written by.
If your team describes your product 10 different ways, your product is no longer differentiated. It's confusing, and so are your customers.
MessageOS helps big teams keep every sales deck, social caption, and support reply on message and on brand.
Clear, consistent, differentiated. Every time someone talks about you.
See how it works at protagonistcomms.co. Daryl Merrill, I've been so excited about this episode today. I've had this in my head for so long. I've had a bone to pick. I'm coming in a little biased, but that's okay. I think it's warranted. I'm so pumped for this one. Are you ready for this?
Yeah, let's get into it. So tell me why you have a bone to pick, Cameron.
Okay, so let's set the stage. Let's set the stage real fast. Today we're talking about, we're in the healthcare space, hospital networks. And we're talking about...
That's hard.
Right. we're going to get into it now. So we're talking
it's also
about
very competitive, or not competitive, but it's a huge topic right now. Like the whole industry is under attack completely, right?
100%.
People are completely anti-healthcare industry. So this will be interesting.
This will be interesting. I think it's going to be. I think it's going to be. People will find this one pretty cool. It's what they did. But we're talking specifically here in the Utah market, as per usual, healthcare hospital networks here, and today we're going to be taking a look at Intermountain Health Intermountain Health versus Steward Healthcare. And if you're here in Utah, like you've obviously heard or seen of Intermountain like healthcare, Intermountain Health hospitals. You were probably born in one, low key.
Were you?
I think so, actually. I was born down in Orem. Were you born in Utah? I actually don't know this.
Yes, I was born in the AF hospital.
Oh, cool.
Yep.
Oh, right where my daughter was. Oh, you and Penny share the same hospital.
Yes, we do, yep.
There you go. All my friends were born in AF. I was the weird one that was born in Orem.
Which is an Intermountain, I believe. The AF hospital is an Intermountain Health hospital.
AF
or am I wrong there?
AF is Intermountain, yep.
Yeah, I thought so.
So, what's the product and service? So obviously we've got hospital care, we've got emergency rooms, intensive care units, surgeries, and then obviously where I was a few weeks ago, labor and delivery for my daughter. And then they have, outside hospitals, they have like clinics, they have outpatient, inpatient stuff, so like primary care physicians and diagnostic imaging and lab testing and all that stuff. So basically just taking care of sick people.
Yeah. I would say, I mean, you can also have like an Intermountain Health clinic, like more of a urgent care, but also like your hospitals. So like really just an overarching like brand, Yeah. There could be lots of different levels of it, but health oriented.
Absolutely. Intermountain Health here in Utah, actually I think kind of in the Intermountain West, hence the name, is kind of a big player, especially here in Utah. They definitely are the big juggernaut in hospital and healthcare here in Utah. They have an insurance company as well, I think it's called Select Health. So they're like way ingrained. And that's because I think, well, obviously they were founded a long time ago, 1975 here in Salt Lake. I think the LDS Church, actually, they formed it. So I think the LDS Church donated its hospitals to the community. So the LDS faith had a bunch of hospitals and then it donated it. And I think that's kind of how Intermountain was spun off from the church and became its own nonprofit entity, which is kind of interesting.
Yeah. And the other one is that we're going to be talking about today is Steward Healthcare industry, or Steward Healthcare. And they were founded in 2010, so about 40 years later, in Dallas, Texas. And they are Caritas Christi system. So they're part of that system, which was started in Massachusetts. And they were privatized and expanded pretty aggressively across the U.S. So now they're into Utah and are a big competitor of Intermountain Healthcare.
Yeah, they have quite a few. I think they have several hospitals and clinics up the Wasatch Front now. So they've kind of come in and they've tried to enter the Utah market, which is kind of interesting. They're privately held, aren't they? They're not nonprofit the way
they're privately held. Yeah.
Gotcha. Cool.
And besides Intermountain Health in Utah, there are very few. Like, I don't think there's any other that have actually started in Utah. I'm pretty sure all the others have started elsewhere and tried to come into Utah market.
Interesting.
I could be wrong. Fact check me on that one, but I don't know of any. So if there are, then it evades me.
So this is why I was excited. So I think, what was it, I don't know. I should know this. 4 years ago, 2 years ago, a while ago, Intermountain Health went through a pretty controversial rebrand. Do you remember this?
Yeah.
Yeah. So they went in and they completely overhauled their brand, their visual brand, and they took it from this kind of safe, clean, sterile hospital vibe where it's very conservative. It looks like all the other hospital brands out there. They took it from this conservative place and they went all out. They went in a totally bold, different direction. And they kind of got martyred for it. Everyone went after them because people hated it and clowned on them when they first announced it.
Oh yeah, definitely. I mean, I remember when it was going to Intermountain for when my wife and I were expecting a baby. We went to, appointments every month or whatever. One of the times I went in there and I was like, oh, wow, like, that's a cool brand. I had never seen it before. So I'd seen it kind of along the street, but I made a comment to her. I was like, oh, do you like the new brand? Because I had seen it and was like super interested by it. And the lady was like, no. She's like, I hate this. She's like,
is this a nurse you're talking to?
Yes, a nurse. Yeah, sorry. This was the nurse. And she was like, I'm keeping these scrubs because they have the old logo on them. She loved the old stuff. She's like, everybody hates it here. She's like, all of the nurses there like don't like it. And so I was like blown away. That was not what I was expecting.
Everyone on LinkedIn, because I was watching it pretty closely, because when I first saw it, I loved it. I was like, oh, that's cool. I love the new direction. And I'll tell you why I loved it mostly here in a little bit. But everyone on LinkedIn was just flaming them, clowning on them. And it was mostly like healthcare workers. It was like their staff. It was the nurses and the doctors and the PAs and stuff. And they were like, what is this? Like, no one asked for this and it's so ugly and it looks like, a child wrote it with crayon or whatever.
That's exactly what she said. Yeah.
Really? Okay, yes. Cool. See?
No, that's exactly. She's like, it's written on with crayon. Like it's like a kid wrote it.
It's like a kid wrote it. Absolutely. So I think let's take a look at it here. I'm going to pull up their website, which has the new brand pretty much everywhere on it. So let's take a look at it here. So you can see here that like really bold, saturated colors. So we got like really, really deep, like periwinkles contrasted with steep salmons and magentas, and it's pretty in your face. It's pretty bold, wouldn't you say?
Yes, definitely.
Total 180 from where it was before.
Can you pull up a picture of their old logo?
Yeah, Intermountain Health old logo. Yeah, so this is what it looked like before. This one right here. So yeah, very conservative, muted blues, greens, safe. Oh, here's a comparison. So yeah, this is what it was before. Oh, this was the other thing too. People hated that they dropped care. It was no longer healthcare. It's just Intermountain Health.
Yeah.
Yeah. But you can see right here, this is quite the departure. They went totally different. It's very awesome.
And,
Anyway,
and different than anyone else, right? Like
yeah.
no health industry has a logo like that.
no one. Absolutely no one. So let's take a look at what Steward looks like. So this is Steward's website. Their logo, maybe this was a horrible comparison because their logo is pretty awful. It's like two boxes stacked on top of each other with the word Steward written on the last one. Jeez. This is we brought a...
What is Common Spirit?
Common Spirit is another healthcare network, or maybe it's a hospital network. Common Spirit Health, commonspirit.org.
Okay, so that's more like what I would expect for a logo in this space.
Common Spirit's another hospital network. They're here in Utah. I'm pretty sure there are other places as well, but this is what they look like. A little more conservative, but it's definitely better than Steward's for sure.
Yeah.
But Intermountain though, totally different.
Wow, just the visual difference between their main landing pages. That's wild.
Yes, 100%. So everyone clowned on him. Everyone was hating on him, saying it was horrible, that the team that put it together, the branding team, should be fired, that it was a bad move. They should have kept it, right? And everyone felt this way. Like, I couldn't find anyone that agreed with me, and I was like, no, this is great. Like, Intermountain, okay, here's my claim. You ready for this? Here's the claim. Intermountain Health was playing chess while all the other suckers were playing checkers. All the other hospital networks still trying to be like this conservative, sterile, boring, self-serious brand. They're all over there trying to maintain like a professional image or whatever. And I think that's a horrible move from a differentiation standpoint. Absolutely horrible move. Intermountain absolutely slayed it. They did exactly what they should have done, and all the haters out there are completely, utterly, and embarrassingly wrong, and they have no idea what they're talking about. There's my rant. There's my hot take.
I really, really wish that I could disagree with you and we could have a fun argument here, but I agree. I think they did such a good job. I was shocked when the nurse said she hated it. I love their branding. I think it matches the patient care. It looks like a child crayon. That's the point, right?
Yeah.
Like, that's exactly what they're going for. I don't want to go into I do want it to be sterile, but I don't want it to feel like that, right? I want to feel like it's a place where I can take my kids and they'll be happy, right? And I don't think you lose credibility when you do that either. No. I don't think you have to show that you're super professional. You're going to be professional, right? So that's just a given. What you want to do is show, hey, this is a space where you can feel comfortable at. And I think that's exactly what they were going for.
Yeah, absolutely. So I was in college doing PR when all of this was starting to take shape, right? And so my PR professor kind of had an in or knew some people that were working in the building trying to put this all together. And he said something super interesting. So that I think is really, really relevant to the topic of like differentiation. So to your point, like we talked earlier offline about like hospitals in general and how would you differentiate yourself? And you were like, well, it's all about care normally. And I was like, yeah, like that's table stakes. Like, I'm not going to go to a hospital that I don't think is going to care about me and my health and how I'm feeling. Like everyone, like that's just, you're not a hospital if you're not doing that. So if that's like if that's where you're planting your flag and if that's how you're trying to differentiate yourself by saying you have like better doctors or something, like, okay, maybe, but also not. Like doctors go through horribly strenuous education and training for years. Like you're not going to get hired if you're not, anyway. That's like table stakes. And so how would you differentiate yourself? If the standard, if the expectation is just good quality care, how, like in your hospital looking to take market share away from the other networks in your area, like how are you going to do it? And Intermountain had a brilliant strategy. My PR professor told me that they hired, I can't remember exactly what the position was, but essentially they hired I think an executive from Disney that was over the park experience. So like Disneyland, Disney World, all these things. They hired the person that was over the experience of these parks. Had like the happiest place on earth. The person that made it the happiest place on earth was in charge of that. Like they brought them onto a hospital network. And I think the whole ethos was, how about we make a hospital not the scary place that smells like alcohol swabs where people go to die? Like, let's make it a place where, there's hope and it's bright. And like, yeah, you're sick and yeah, you might be in a difficult situation, but like, at least you don't have to wake up like between 4 sterile white walls and fluorescent lights beating down on you. Like, let's make it, a positive environment. And I think that's what they were trying to do with this rebrand, was differentiate themselves. They were trying to have the brand match the strategy of, hey, hospital, healthcare, health scares, conditions, like these are serious things. We take them seriously, but we also want you to feel like you're you're not in imminent death. You're not fearing. You're in a comfortable place where you can maybe enjoy yourself more than you otherwise would in other networks.
Oh wow, I love that. I mean, one of the reasons I love that so much is because nowadays you hear the best therapy is go on a vacation or something, right? If you want marital happiness or whatever, skip the therapy, go on vacation. I'm not condoning that at all. I'm
right.
Therapy is amazing and great. But I think having a hospital, like if you go into a hospital and it smells like death or it looks like death, like you're going to feel like death, right? So adding in that happy feeling is like medication in itself, right? Like that could be a huge benefactor for like just being in the hospital. That's a great move. Hire the Disney, make it feel like fun, make it, obviously it's not Disneyland, but you got to make it, make the experience a positive experience, or else like your patients are, a lot of it is it can be psychological. It's both, right? There's a lot of physical and psychological elements. So if we can make both of those match how you want to feel when you leave the hospital, that's where you want to go.
Absolutely. Totally. I don't know if that's the case still. I don't know if that person from Disney's still there. So a lot of this might have been like what could have been. I have no idea. But if any Intermountain Health executives are listening to this, that is a brilliant strategy from a differentiation perspective. Absolutely freaking brilliant. 100%. I think that if you played that out over time and you stuck with it, that would win. That would win so hard.
Yeah. Oh yeah. And we'd love to talk to you if you're willing.
Yeah, we'd love to. Come on. Like I want to know what it was like from the inside putting that together and what your reaction was to the public's reaction.
Oh, that would be so interesting.
I'd love to hear what y'all thought.
We're kind of forgetting some of the company, or this is a war, so we got to talk a little bit about Steward Healthcare as well. However, before we do that, I wanted to comment. One of the things I did in preparation for this was try to find out any information on, besides the public reaction, like did it affect the bottom line, right? Did it actually change anything? And unfortunately, they expanded. They purchased another company during that same time. So I can't tell whether their revenue increases was due to the rebranding or just due to the expansion in market. So I don't have any of that information, but if there's any insider in Intermountain Health that does, I would love to see that.
It'd be so interesting to see how that went. 100%. So Steward Health. So I just, I sung my praises to Intermountain. I think they were brilliant, and anyone that says differently is an infidel. should be shunned for their opinion. Let's talk about Steward. Obviously, their visual identity is very similar to most other hospital networks. So, and I don't think you can differentiate yourself entirely off of your visual identity. I think it's part of it, but I don't think you can build a long-term competitive advantage just based off of your logo. So
yeah, we kind of talked about that with Lola. That currently they're only doing it visually. They need the messaging to match the visual.
Yeah.
So I think similarly here, you need to show that in your messaging as well, in your words.
And to be fair to Steward, Intermountain doesn't really have message that they're, they don't message their, if it was still their competitive, if that was still their thing they were trying to differentiate themselves on, is the end patient experience, like they don't message that very well, that's still not on their website. It's not on their social media. Like they very much still play the, like, we're a hospital and you can come here to get better because our doctors are the best in the world game. Like, and that's a losing game. They should definitely match the message to the brand.
And I wonder if that was part of the reason so many people hate Intermountain Health's brand, like their current brand, right? Maybe they did it visually, but stopped with the words, right? They didn't say why they were doing it that way.
Oh, yeah, interesting. That would be interesting. I mean, so like, maybe. So like their H1 on their website says, let's look at health in a whole new way. We believe caring for your health is a journey from helping you get well to guiding you to live your healthiest life possible. We're here to support you every step of the way. Okay, so like they start... I mean, what would you say this H1 is? Is it kind of hero language? Let's look at health and... No.
Kind of. I
Maybe
think it's pretty
product
vague,
language.
honestly.
It's way vague. Way vague. And then obviously find doctors, find locations, patient portal, care for every stage of life. So this is pretty run-of-the-mill for patients billing. So they really, I feel like this is the healthcare equivalent of what you hate the most, when you hop on a site and there's no messaging and they throw you straight into the products. Like, I feel like they just did this. They just throw you in to find a doctor, find whatever, but they whiff the messaging at the very top.
Yeah. I mean, we believe caring. It's like we said, caring is table stakes.
Right, yep. And you still have to message that, but it shouldn't be the first thing you say. It should maybe be the second thing you say. Maybe even the third, For patients, you're a trusted partner in health. It's our mission to help you live your healthiest possible life. See, I feel like that right here, help you live your healthiest possible life. I'll bet you dollars to donuts that's on every hospital's website.
Yeah.
Like, live your healthiest possible life. It's great hero language. Like, live a healthy life. That's great, But I think it's table stakes. I think that's like second order hero language. If you were to go one layer above and like add your differentiation into it, hero language might be get the care you need without feeling like you're in a hospital or something like that. Something about I don't know what it would be, but I think that's where you should go.
Yeah, you can be witty about it. Find something that is. I know they're obviously concerned about legal issues, and it can be hard to create something. You can't say the funnest hospital ever like that. Right. That's not going to go down well. People are really going to make fun of that.
Right.
But there's a way to say that without saying it.
Oh, cool. 50 years. Love that. Everything else is pretty standard and run-of-the-mill here on Intermountain Health's website. What's Steward say? What does Steward say? The H1, our purpose, we are fighting for a healthier world in a new era of wellness. Okay, so I feel, same vibes, would you say?
Yeah, yeah.
A new era of wellness, and let's look at health in a new way. Okay, yeah, so they're all, same thing. Same thing on the messaging stand front.
I also hate, like you said, the we. They are not the hero. Nobody cares about Steward.
Correct. And then they have this meaty paragraph here. Goodness gracious. Okay, yeah, to your point, talking about how you're not the hero. This paragraph is all about them. We set out, nearly a decade ago, to build an entirely different kind of healthcare company from the ground up. Yeah. One that unlocks access to affordable, high quality, and economically sustainable care. Okay, cool. So I did hear this. So talking about differentiation and what Steward could do, it seems like I have heard and read that they try to be on the affordable, price-conscious consumer/patient, whereas Intermountain is priced way up in the market. They're the premium provider. Okay. And so to that point, like, high quality and economically sustainable care and wellness in ways never before imagined. Sorry, well, that last part's stupid, but high quality and economically sustainable care. Like that could be a differentiating factor. Like going after your target audience that's a little lower in the market in terms of just price conscientiousness. I think that could be a winning strategy.
Yeah. Oh, I love that. In fact, like that's one of the big issues in today's economy, like in today's, the reason people hate healthcare right now is the expense side. So it's not even that it has to be like dirt cheap or it's just, hey, we try and make sure that you're not getting hosed when you come to our hospital, right?
Right.
Which obviously there's only so much you can do, but that could be some good messaging of, we're going against the grain of ripping you off,
Yeah.
Put that in much nicer words and stick it on here. People would love that.
Yeah, 100%. I mean, I could even see, so like the H1 using problem language could be something, a little nicer version of like, most hospitals fleece you. Like,
yes,
most hospitals or most care networks, to to operate on your kidney, they steal your liver. Something like that. Great.
That's great.
Problem language like that. And then the H2 could be, their product language, which is, we're built to be affordable. You're not gonna get surprise bills that make you want to crawl under a rock and die, or maybe not die, but
yes.
That'd be I think that'd be a really they could build a really defensible competitive moat for themselves off that.
People would go.
Absolutely.
Yeah, you need to make sure that you're not making it sound like it's low quality. Because if you do, then people won't go, right? You're not going to go to a low quality.
So scrolling down here, let's look at this. So over the last decade, Steward Healthcare has perfected a unique, vertically and horizontally integrated model that achieves the highest quality care, increases patient access, and substantially reduces total medical expenses. Okay, cool. So they are kind of touting differentiated factors here. That's interesting. It's just buried in crazy paragraphs. It's just unclear. So talking about how you can, when it comes to messaging and differentiation, you can compete on two things, we think. You can compete on clarity and uniqueness. I think they're kind of cool in the uniqueness category. So like vertically and horizontally integrated, increase patient access, reduce expenses, but you're kind of low on the clarity, would you say?
Oh, yeah. Nobody's going to read those paragraphs. Mm-mm. I mean, this belongs in the About Us tab, maybe.
Right. Right.
Like, if I want to know about you, then I'm willing to read paragraphs. But if I'm on your main website page, I want easily readable titles and subtitles.
Yeah. So I'd say, Steward, cool. I think so are they differentiated? Steward, I think they are. At first glance, it looks like you are. It looks like you're doing some cool stuff with the way you're managing your network. It's just unclear. I wouldn't understand how you're different or how that's more valuable to me because I have to read 2 novels before I get to the information.
Yeah, that's a really great point. Cameron, what made you go to the AF hospital to have your baby?
It was close.
Okay, yeah, that's one thing. But often it's also on your insurance, right?
Oh, very true. Are you in network? Yeah, so it's kind of a weird thing. There are lots of extenuating circumstances that would make it difficult.
Yeah. So,
but I mean, like, what if it was a factor? Like, what if okay, like, so let's do like marketing. We're like the marketing team for one of these companies. Like, what if that's where you were targeting is like when people are choosing their insurance and you're trying to persuade them to get on the plan that, you're in network for Intermountain or you're in network for Steward.
Yeah.
I don't know.
Yeah, no, totally.
Weeds, but that'd be interesting.
I mean, our insurance, we have options, right? There's like 2 different options of in-network versus out-network, out-of-network. So, like, we could pay more of a premium to have a larger choice in hospital for our insurance needs. So, that is still relevant for the end consumer, because I had to make a choice of, is it worth it to me to get the more expensive hospital to potentially also be able to use Steward Health or Intermountain. So even though a lot of it is due to insurance, you still have to be marketing towards the end consumer.
Absolutely. Okay, Daryl, are these two differentiated? Is Intermountain differentiated and is Steward differentiated? What would you say?
Yeah, I think you said it best. I mean, I don't think Intermountain Health was at all. Besides being the closest hospital to you, I think they have now made their niche of differentiation and making it a good experience, making coming to the hospital a good experience. And I think they really did that well. Steward Health, I think we have also shown that although they aren't very clear, they are also very differentiated from Intermountain Health. So I think two different groups of people would go to those two different kinds of hospitals. So they did differentiate themselves.
And that's a problem we see time and time again when we're working with founders or companies that want to be differentiated and communicate that is, you are differentiated. Your product is different in a meaningful way. The problem is getting that message clearly and consistently across all your channels, right? Getting all of your team members to say the same thing. No one injects their opinion. No one injects their point of view. There's one point of view. There's one message. Say it this way. Don't say anything else. That's really, really hard for big corporations like these two hospital networks to do. Absolutely. Big problem. And if you feel like you have that problem, Daryl and I do this all day long. We help companies over at Protagonist. We help companies who are differentiated communicate that clearly. And if you're not differentiated, we kind of help figure out, are you differentiated? Philip Coulter has a great quote. He says, there's no such thing as a commodity. It's just a product waiting to be differentiated. So chances are there is something you're doing different. You're just not either A, recognizing it, or B, communicating it, and you have to do both. If you need help something like that, go over to protagonistcomps.co. We'll help you out.